any kind as to race, color, sex, language, religion, political or other opinion, national or social origin, property, birth, or other status. The Committee on Economic, Social, and Cultural Rights had issued a General Comment 20 on non-discrimination and actually made specific reference to budgets. Specifically, it said, economic policies such as budgetary allocations should pay attention to the need to guarantee the effective enjoyment of rights without discrimination. And that obligation, the obligation of non-discrimination, falls on all levels of government, national and subnational, state down to local. And this discussion of the obligations on different levels of government you'll find in the Sonora Ciudadana case study, which you will hear about shortly, and the ASI case study, both of which are in the handbook. While the General Comment 20 mentions budgetary allocations, the same non-discrimination obligation would apply to revenue. For example, different taxing schemes have differential impacts, and so the obligation of non-discrimination becomes very important with regard to revenue. And as you all know, non-discrimination is an immediate and cross-cutting obligation. It's probably conceptually the easiest of the three obligations in Article 2 of the ICESCR. The challenge is not so much conceptual as practical in implementing it when it comes to the budget. The committee makes a distinction between formal and substantive discrimination. Formal discrimination is discrimination that is apparent on its face, whether it's in policies or in budgets. Most often, however, with budgets, we're talking about substantive discrimination, where the discrimination is not apparent on the face of it, but when you actually look at the numbers and consider the numbers in relationship to other data, the impact turns out to be discriminatory. And this discriminatory impact is obvious in the Peace and Development Volunteers case study as well as the ASIJ case study in the handbook. And the existence of substantive discrimination puts an obligation on governments to identify that type of discrimination through monitoring the impact of the budget on different populations. Where discrimination exists, governments must reorient their budgets to aim towards a situation of equality and non-discrimination. And this process of rejigging the budget should also be guided by the other two Article 2 obligations. And this is, in fact, where the actual practical application of the obligation of non-discrimination can get quite complex, because at the same time that governments need to not discriminate in the budget, they need to use the maximum available resources and progressively realize the rights of all of the population. So it can present challenges putting all of that together, but they need to be seen together. And the government has said when you have discrimination that a lack of available resource is not an acceptable justification for inaction unless every effort has been made to use all available resources to eliminate the discrimination as a matter of priority. And there already you see the relationship with the maximum available resources. The committee has also spoken about special measures that states parties may, and in some cases should, take special measures to redress situations resulting from historical discrimination. And as it specifically relates to the budget, that means that special measures will, in many cases, require that the governments direct disproportionately greater resources to the group suffering the discrimination. And the case study in the handbook from the National Coalition for Dalit Human Rights speaks exactly to that situation. And then finally, the private sector and discrimination. As you all know, that governments must take measures to ensure that individuals and entities in the private sphere do not discriminate. And the implications for the budget is that governments must ensure that monitoring and regulatory bodies that are overseeing the actions of from private actors in areas that affect economic and social rights should be adequately funded. It's not enough to set up the monitoring and regulatory bodies. They have to be adequately funded so they can do their work. So before I hand it over to Guillermo Noriega, I want to, again, this is the link to the whole handbook. If you haven't read the handbook as a whole, we would certainly encourage you to do so. There's some really useful case studies in there, as well as the conceptual booklets on each of the three obligations. And finally, I would say this is a learning process. I said this in the first webinar, and I would say it again. This is a learning process. We're all learning as we go. The handbook itself was a result of a collective learning process, and that collective learning process is ongoing even as we speak. And so to the extent that your organization has experiences and you have suggestions, ideas, and so on, please, this is really a wonderful opportunity to share that and to enhance the collective learning. Thanks very much. So I am going to turn it over to Guillermo Noriega.
Thank you very much, Anne. We're ready for you, Memo.
Okay. Are you watching this?
Yes.
Can you hear me well?
Yes, go ahead.
Good morning to all. I want to thank the IBP for the invitation and for organizing these webinars in order to continue the discussions around human rights, public budgets, and the principles established in Article 2 of the ICESCR. And well, we don't need to rewrite the whole article and just explain it in such a splendid way, but it is important to remember the three principles. They are important as a whole, and governments shall guarantee progressive realization of economical, social, and cultural human rights using the maximum of available resources and doing so with any sort of discrimination. It is important for this presentation to underline that the rights recognized by the Covenant shall be exercised without discrimination of any kind. Thus, we understand that access to right to health shall be guaranteed. Excuse me. This is a problem. Shall be guaranteed regardless sex, language, race, color, national origin, and it seems obvious, but it is not, regardless any health condition. Let me insist, it doesn't matter how ill you are, you still have the same rights as those who are as healthy and fresh as a spring blossom. Or it doesn't matter how old you are, you still have the same rights. It seems logic and absurd, but it is not. Many countries like Mexico, governments sign international treaties, recognize human rights on their constitutions, and when it comes to implementation, they use legislation or diverse regulations to avoid fulfillment. In Mexico, fragmentation of public health service is a problem. First, because you have the right to health when you have an employment status, and your right to health is linked to it. If you're a private employee, you will get the attention of IMSS, that's one institution, but if you're unemployed, with a chance you will get the popular insurance, which is another institution. Public workers receive attention from other institutions, and so I will not talk about the nature of this multiple institutional system, but I will say it makes discrimination easier, and its design itself discriminates. Some get better quality service than others, depending on the institution. In accessing health services, regulation is diverse, and authorities have not enough oversight capacities to prevent, avoid, or fight discrimination. And I refer to central government, for instance. Discriminate to save has become a common practice, and governments just don't stop to demonstrate they are already using the maximum of available resources and they are on their limits. So That's how we knew that in Sonora, people with pre-existing health conditions were rejected by the government institution called ISTESON. So if a public worker had diabetes or any other disease, as HIV or cancer, government used to reject the admission. Why? Ill people is expensive to treat. In other words, only healthy people had the chance to exercise their right to health. As I was saying, it seems logic, but it is not. I like to say it is as stupid as rejecting kids from entering schools if they don't know how to read and write, because it is expensive to teach them. We found it was an increasing national issue. Governments were rejecting and discriminating ill people without demonstrating they were using the maximum of available resources to prevent it. Discrimination was not justified, and Supreme Court gave us the reason. The rebellion of the sick, or the rebellion of the ill, became a fight in many sides. We created and empowered a community of affected persons, gave them the tools to speak up, and took them to courts, to the media, and Congress. Thanks to budget analysis, we found the institution's financial health was delegated due to other administrative reasons and demonstrated the change was possible. The institution was in permanent deficit due to the debt and didn't know how much it would really cost to reform. We made costings of medicines, treatments, and compared with an actual expenditure. That's how we got to know how much money was needed annually. The most important finding was that for more than 14 years, a public health institution discriminated thousands of people with a non-accurate argument. They thought accepting people with pre-existing conditions could lead the institution to financial collapse. That was wrong. Discrimination was not needed, but a reform, an administrative reform instead. So we pushed for accessing information, for public explanations, for evidence to understand the nature of the practice. We pushed to be heard and to get the reform. This is Carlos Gomez Maqueo. He died a couple of years ago, but he died having his medicines and his treatments and his right. So we, in 2010, State Congress, Sonora State Congress, reformed the law and banned discrimination, and more allocations were approved for the institution. Sonora decided to take the rebellion to the state of Nuevo León. Same strategies brought same results. In 2012, State Congress reformed the law and banned discrimination. And next year, in 2013, we decided to take the rebellion to the national level, and multiple sclerosis patients are legally suing federal government for the popular insurance discriminatory regulations. And this is a fight for their treatments and medical attention, and it would benefit others with expensive diseases that are being excluded by authorities. I'm finishing right now. Learnings. Well, first, strategic litigation isn't enough. It is mandatory to give a comprehensive battle using budget analysis and budget arguments. Using access to information as a tool, creating and empower a community, teaching them how to address the media, how to speak up, and how to use the budget as a powerful tool when it comes to advocacy. It is amazing how decision makers can change if they listen more arguments than complaints and requests. Second, governments won't stop and change unless we help them or push them. Inertia of their work is strong, and change isn't an easy option for them. We, society, NGOs, must push for them to demonstrate if their policies and laws are respecting the international principles established, especially those in Article 2 of ICESER, unreformed if they aren't. And third, back in the 80s, we had in Mexico a superhero cartoon named Calimán. Its most popular saying was serenity and patience. When it comes to human rights budgets analysis and pushing for changes to fight discrimination, serenity and patience are much very needed. Thank you very much for your attention.
Thank you very much, Guillermo and Anne. Thank you for illustrating the very important principle of non-discrimination through these excellent presentations. Now we're going to open the floor to your questions. I'm going to leave both Guillermo and Anne unmuted so that they can respond to your questions or comments. So please feel free to use the chat box to type in any comments or questions, or you can click the hand icon next to your name and I can unmute you so you can ask your questions directly.
Mauricio, one question, one issue it would be helpful, I think, if Memo could talk a little bit about. People ask frequently about costing, and costing can be quite a complex process. And I'm just wondering what the experience of Sonora was in the costing that it did. I mean, how difficult was it to do? How elaborate was the costing?
Thank you for that, and I would like to add on to your question to Memo and ask Memo if you can also talk about the capacity building that you did with the within the communities and the people that participated in the campaign to do this type of work.
Sure, of course. Thank you for your questions. And costing is a complicated thing to do, especially if you're not familiar with the procurement processes institutions have. We weren't, so we had to learn on the process. Rocio, can you please allow me to show my screen so everybody can see?
Yes. You're still the presenter, so we can see what you're doing.
Oh my God! Well, here you can see part of the research we made, and what we did is using the transparency law, we asked how much was the medicine, for instance, for diabetes, how much the institution was paying in the procurement process, how much they were paying to private institutions to give the medicine, and how much it costs in the public or in the private sector. With that information, we compared giving, for instance, one medicine to a diabetic person in the private sector versus how much it costs in the procurement process or in any procurement process of the institutions, health institutions. So here we were comparing in pesos. There were a difference for this medicine or for around 8,000%, because in the private sector it was much more expensive. So with that information, we had the chance to calculate and how much it will cost for the entire people that were diabetic and rejected by the institution. And then we could say, you know, annually you will need for clinical analysis, for medicines and for treatments, every patient will cost you around 6,000 pesos, and that you can afford it if you do such cuts, or if you stop wasting your money in similar ways. So that way we built an argument. You do have money to treat diabetic people, and you do have money to treat hypertension And still one more thing is that we used the worst scenario as possible. The best scenario is this, normal treatments, and the worst scenario is clinic intervention with, I don't know how to say it in English, but with the complication on their health status. So if a people gets really sick, how much could the institution need to spend to treat them? So we did the same process as well, and we showed them the two scenarios, the best scenario and the worst scenario. In both, they had the chance to afford it. Rocio, capacity building. I don't know if with that, and I can respond to your question. But well, in capacity building, we received public workers, policemen, firemen, teachers that were being rejected, and I'm talking about primary teachers, some from colleges, some others with preparation, and we taught them first the logic of the media. They needed to be the actors of this fight. So we taught them how they could communicate to the media. Second, we taught them to use the transparency law so they could ask, and they were our army asking government around many issues. Third, that the most important or the most difficult thing to do was to make them understand they were subjects of rights. That what we were doing there, it wasn't asking for the government for a favor or asking them to give us something because of they are a good persons. No, that was almost the most difficult thing to do. When they understood that, they became very strong and powerful communicators. And the last, it was the budget training we had with them. It was very difficult as well, but they came to understand the logic of budget arguments, and as important, there's a history that when we sat and talked to the president of State Congress, one of them said, do you know how much it cost us, your salary, and how many medicines my wife could have with that salary? And he came with the number, and it was a very strong thing to say to the president of the Congress, and it was very good at it. So that way, empowering a community is a very important thing to do in this kind of fights, and well, I hope that will answer your question as well.
Thank you, Memo. There's a question from the floor.
Yeah, Rosa, I know that I think it's Sunita saying yes.
Yes.
Yeah, Sunita, I think, was asked a similar question last week again about mental health. Can you unmute Sunita? Because I think this is definitely something it would be good to discuss rather than just try to.
Go ahead, Sunita. We can hear you.
Yeah, hi. Can you hear me?
Yes, go ahead.
Yes, I'm just from past 1.5 years, I have started working in mental health issue, and this is something which has not been, in priority issue in health department, and it has been not seen as a part of the general health. So I'm just, I had a discussion with my supervisor, and then we are thinking of starting something in trying to look at, how budgets are going and how to initiate it, just we are still, grappling with it. And so this is something which, if you all can guide us or, let us know how to initiate it and what to look at, in terms of, and there is lots of, discrimination, there are lots of, issues, which is occurring, and I'm working at the tertiary level as well as I have worked in the primary care level as well. There's minimum resources available, and there are lots. There's understaffing is there, and no training has been given. So how we can start this? And it's not very easy thing to tap on, but we are still, thinking of.
Yeah. No, I think it's really important. Sunita, why do you think that the budget is involved in this?
Can you repeat your question again?
I mean, I think the starting question is, why do you think the government's budget is involved in the situation that you're seeing?
Why it is involved?
Yeah.
Yes, because if you look at the other health issues which government is looking at in India, that's, say for instance, this is the largest budget is going on, this the National Rural Health Mission, and mental health is not part of it, yeah. And there's another, like, maternal and child health there is a huge chunk of money is going over there, and lots of money, which is the priority issues for them. So, and which is, and they think that this is not something which, it should be part of the general health issues. But, when we look at the maternal health, mental health is something which is very important, yeah. Mm-hmm. So, in fact, my interest was to look at the maternal mental health issue, but now I am just focusing general common mental disorder, which is very prevalent when you look at the village level as well as, district level and, subnational level. So, this advocacy is very important, and very small group of people are working on this issue. Yeah. Mm-hmm. So, am I making myself clear to you?
Yeah. No. The reason why I ask is that yes, the issue is there. I was just curious why you specifically were looking at the budget, and what I heard you say was that there's money clearly allocated for other areas, but not allocated. That you can see much for mental health. I mean, that's, I guess, so you've already started looking at the budget. I think it's the whole process, I think, of looking at an issue and looking at rights is a sort of an iterative process. You need to get an understanding of the issue and then look at the budget and so on and see where things are being spent. So again, where do you, one of the questions I would have, I guess, is where do you think the primary budget question comes? Is it at the national level, the state, or the local level? Where should the money be that it's not?
Basically now I think someone, can I speak or?
Yes, go ahead, Sunita.
Yeah, so basically, see, lots of money has been located at the national level, and because it's a national program, which they call it, and then there is some state government monies there in terms of staffing, like their salary comes from the state government, yeah, and there's some other program which for the maintenance of building. And and other equipments, the money comes from the central government. So it's very like it's not the only one place. There are different sections which get funded, yeah. And it's not that there is no money has been allocated for mental health, but the budgeting process is so slow that every after 2 years or 3 years they get the money. Like I was working in one of the sub-district sub-national level in another state. And they have not got the money from last 3 years, and the staff is working without the money over there, and nobody is there to look after them. So that kind of issues are there, and everybody is waiting that money will come. And there three mental health district mental health program has been shut down. Nobody is there. So that kind of issue is there, and nobody is there to raise all these things. Advocacy is not done at that level like other health issues.
I have questions.
Please, Guillermo, go ahead.
First of all, thank you, Sunita, for being here.
Hi. Good to hear you.
It's good to hear you too. First, I would like to say, I have questions. I don't have answers. Questions that perhaps they could guide you. And First, as Anne was saying, how does it look in the budget? This problem of mental health issues not being a priority. What's the budget problem then? Second, what are the effects of this? And you have to document the effect of the problem, of the budget problem. And, third, how this is a problem to the public, how this problem becomes a public problem, and not only a sector problem. And that way, you will be able to communicate to the decision makers in some point. This is a problem that has to be solved. If they don't see this as a problem, it won't be solved never. And also you have to think in how many people is being involved or how many people is affected around these problems, around these issues, and if there is already a community to work with, or do you have to create one? For instance,
sorry, I missed your point. You know, are you cutting off?
The last thing. Do you hear me right now?
Yeah, I can hear you.
What I was saying is that you have to think as well if there is a community you could work with, or do you have to create one? In our experiences, the first two goals we had to create a community and enforce it. In the national level fight we're dealing with right now, we already had a community, an existing community, so we're working with a multiple sclerosis association, and they already are organized and empowered, so I believe it's going to be easier than the first. So those questions will lead you to see the problem as a public problem that could be solved, and with having a community to come with you, it will be perfect, or it will be great. That's my opinion.
Thank you. That's really very helpful. Thanks a lot.
Thank you, Sunita.
Thank you very much, Sunita. On the same issue, there's somebody else from the floor who'd like to add something. Nancy, you can go ahead. You have muted yourself, so you need to unmute yourself, Nancy, so we can hear you. Okay, I'm going to go ahead and read Nancy's question. She says, in Haiti, the last 4 years, there has been no, okay, go ahead, Nancy. Now you are unmuted. I'll let you go ahead and ask your question. Nancy, we can hear you. Okay, Nancy asks, in Haiti, the last 4 years, there has been no budget voted by the legislator. It is the same budget since 2009 because of political conflicts, but also because Haitians don't actually have the right to a budget, nor the right to participate in the budget process. Thank you for your comment.
Well,
Are there any reactions?
Yeah, well, we had the same in 2011 in Sonora State. We didn't have a new budget, so the old budget had to come and spend. It is a problem, yes it is. I guess we thought that having something that we call in Mexico reconduction, it was it was going to solve all our problems, but well, not all of them, but mainly the problem that politicals don't get in the agreements. I believe there is a problem. I don't know if it comes with the non-discrimination issue, but you could think around how is the budget on health being, you know, how is the amount of the budget, and if you take away the inflation, you could think the budget in health, for instance, is decreasing. And if it is decreasing, you would have, or you will probably have a litigation argument there. That's my point of view. That's a possibility. For instance, if health budget is decreasing annually because it is the same budget, and they don't approve a new one, inflation perhaps is doing its work. So I don't know. It's a possibility.
Rosie, I also see that question as related to the previous question that Anna Schnell raised about civil and political rights. It says the handbook is about ESC rights, but I was wondering what discussions you have had or thoughts you have about in what way civil and political rights need to be part of the equation in order for resources to reach people that are marginalized. And I guess my question is, was it possible, easy to separate ESC rights and civil and political rights when we did the non-discrimination part of the handbook? Obviously the Mexico, that would be memo to speak to. In terms of the handbook, I mean, it was easy because we decided we had to do it. I mean, what we were focusing on was Article 2, and so we kept our focus on that. But it's also very clear that there is an integral relationship between the rights in the covenant and issues such as participation, access to information, and so on. I think probably one of the main reasons we didn't really spend a lot of time on those was because those are not, in terms of the budget, those are not conceptually that difficult, and they're pretty much accepted in terms of good budget practices that transparency, this is the work that IBP does on transparency, access to information about the budget, and then also people's participation in the budget. So it's absolutely central. There's no question that access to information facilitates civil society budget work enormously. It's not totally essential. The organizations have worked on budgets without easy access to budget information, but they can do much more effective and in-depth work if they have the access, and obviously participation is very much what Memo was talking about. I mean, I'll just take this opportunity, though, to say on civil and political rights, generally, this is an area that we have, beyond access to information and participation, we have started consulting and talking about how budget work can tie into civil and political rights enforcements. There are a number of questions that arise there, but certainly it's as applicable to civil and political rights as it is to economic and social rights. And now that we have looked and understood a lot more about the obligations with respect to economic, social, and cultural rights, I think the groups that have been working on that feel greater confidence to sort of try to jump into the civil and political rights issues from a budget perspective, and obviously some groups are already doing that. So, but Memo may want to speak to that second part, the practical work in Mexico.
Yeah, I do. Thank you, Ann. In the practical ways, I believe not letting people to participate in the budgeting process is a constant, and it's permanent, and is not only a monopoly of Mexico's political system or anywhere. That's a worldwide reality. Politicians don't want society to participate in the budgeting process. What we have come to do in this process is, for instance, past December, they were discussing budget in the state of Sonora. They didn't have hearings. They didn't have public sessions. One Saturday, 17 on December, Saturday at 3 a.m. in the morning, they gathered together and they approved not only the budget, but 33 laws in around 2 hours or so. So we sue them, and right now we are in the courts asking for the Supreme Court to declare illegal not only the budget because they violated the legislative process, but as well as provisions of transparency. They violated our human right to information, and we're dealing with many things. We don't know how this will end up, but I believe it is important for us to speak up and fight for it. And as well, I don't know if that answers the question about participations and about the right to be part of the budget discussion. And but I don't know if I mixed the questions. I read around here, but that's all for now.
Thank you, Memo. Emmanuel Camonio is asking if the presentation could be shared. Both presentations will be available on the IVP website later today, along with a link to the recording of this webinar. And Emmanuel is also asking, Memo, if you can share the report on diabetes and if that's available in English.
It is not available in English, but we will do our best to translate it this year, I promise.
Okay. And Anna she cannot speak directly. She's in a public place, but she thanks for the responses.
Okay. I'm wondering if there is somebody from the National Coalition for Dalit Human Rights among the participants. I know there was somebody from NCDHR on the list, but I'm not sure whether they are there. But if they are, I'm wondering whether they would be willing to share some of their experiences. It's one of the booklets in the handbook, but it's also a situation that's not just that has to do with special measures, which I mentioned, and that I know it's not just the Dalits in India who are experiencing that sort of historical discrimination and the need for redress, but in many countries, and I'm just wondering if there is somebody from NCDHR on the call.
I don't think so, Anne.
Okay.
Thank you very much. Are there any other comments or questions?
Only to thank Emmanuel and all of you. Just to tell you, well, I will send you our YouTube videos in your YouTube channels. You can see more around this, and I will do my best to send it to you. Thank you.
Oh, Bina is here from NCDHR.
Great.
Okay, Bina, if you don't mind, I will unmute you. Go ahead, Bina. We can listen to you.
Hi, everybody. Bina here. I'm sorry I couldn't. I think I joined a bit late, but Anna, thanks for bringing on the situation of the marginalized communities, the Dalits in India. For the others, there is a special budgetary allocations specifically for the development of the marginalized, the Dalits and Adivasis, proportionate to the population of the communities, so which means Dalits about 16.2% and Adivasis, which is the indigenous communities, about 8.2%. But absolutely, I mean, it's only a policy now in, I mean, they're just guidelines now. But in two states, they've now become legislation. So there's a national coalition that's pushing for a legislation. But also, if you look at the implementation of these plans, they call the Special Competent Plan, Tribal Sub-Plan, or the Scheduled Caste Sub-Plan. these plans are, there's so much of problem with the implementation. There's very ineffective implementation, but also the population proportionate. First of all, they don't allocate proportionate to the population, but also there's a lot of diversions that happens over the years, and I think IBP has also done a case study on the diversion on the Commonwealth Games, where about I can't translate it in dollars, but about 744 crores. That's I don't know what it would translate into dollars, but that's a lot of money that we could change lives here. I was just listening to the others as well in terms of participation and planning. I think it's the same situation everywhere in India as well, that somebody just sits and does an accounting exercise, and just sort of says, okay, this much of the budget will allocate this year for under these plans, but there is no participation at all of the communities that these plans actually go out to. So a few things. Diversion is a very big, huge issue. The improportionate allocations, so the allocations are not enough. And of course, huge, how do I say, if they're meant for providing housing, or if they're meant for providing scholarships for these students from these communities, they used to recently. Today we were doing an analysis and we came to know that they actually bought planes. In one state they actually spent on buying planes, or in some states they spent on building jails from this money. So, and there's absolutely a lack of accountability. Sorry, Anna, I've taken a lot of time, but I think for now I'll just stop here.
I have a question on that, Bina.
Yes.
When I was reading, this was the IBP case study on which, when we included it in the handbook, we relied on that case study. But one of the questions I had was that what I understood NCDHR was calling for was a proportional amount of the budget, of the relevant budgets, to go to Dalit and other groups. And so, if you have 16% of the population, then 16% of the budget. And I was wondering why only 16% of the budget when there was historical discrimination. In other words, there's a lot of catching up to do. So I was just curious why you didn't ask for more than just the population share.
I think when these policies were actually, it started in 1974. When the then Prime Minister started these policies, at that time there was a huge gap already because of the discrimination, historical discrimination that has been there. And when they got in these policies, at that time they decided, because of a lack of probably another formula, they decided that we would probably get proportionate allocation to the population at that time, and then the guidelines stayed, they remained so far. I think can you hear me?
Yes.
Yes.
Yeah, and also I think another thing also is that even that much, even the 16.2% of the state and the center is not being given. So even if they give the 16% and it's effect, hello, can you hear me?
No.
Bina, can you repeat the last sentence that you said?
Hello? Yeah, I said that even if they give that much, even if they allocate 16.2% of the total budget and they effectively implement it, probably if they had done that since 1974, in the last 35 years, they could have made such a huge lot of change, So we are pushing at least that the present guidelines should be adhered to, which is 16.2%. I don't think they will, if we ask for more allocation, they're going to give us. I don't think they would. So what we are now pushing is at least what the guideline says, if they even do that. Today, at the national level, they've only given 9% allocation. This year, 2014-15 budget, they've only allocated about 9-point-something percentage. So they're still not allocating the full percentage by saying that, there are other general schemes which are of no use to the Dalits anyways, but that is their explanation. So even if they give us that, I think it should do wonders, at least to a certain extent.
Thank you, Vina.
Okay, Anna.
Thanks.
Guillermo and Anna, if you don't mind, I wanted to go back to the issue of, if you don't have any further comments on Vina's
No, that's very helpful. Thanks, Vina.
It was enough. Thank you.
comments, I wanted to go back to the issue of fragmentation in the health system. I think this is an issue faced in many developing countries in around the world, and if this is if this enables discrimination, this is something that should be studied by civil society organizations when looking into cases of discrimination. So I was just wondering, Memo, if in your experience you have any advice on how to tackle the issue of fragmentation when looking at cases of discrimination in the health system.
There's a belief that having one universal system with one set of rules for everyone who tackle discrimination in many senses, we still don't. We still are. I don't know how to say it, but we still think there is lots to do in investing enough money, but around infrastructure and medicines, and that only universal system, one system for everybody, as that won't solve the entire problem. However, the national government is discussing this issue in this moment. The new government, the national government, brought this issue on their campaign, and is probably in the next years it's going to be one issue around the public debate. So we are trying to fight before this happens, giving enough arguments to say, if you want one single universal system for the entire nation, regardless your employment status, it's okay, but you have to do it without discriminating some illnesses or some people. So discrimination has to be an issue. It could help, because it is amazing how international agreements, the Constitution, even the general laws, gives the right, and how one single regulation in the state in the north of Mexico just erased those rights without any consideration. So yes, perhaps it could help, but we still are. No, we want to say that we don't know. We don't want to have many expectations around it.
But I think what Memo is talking about brings up an important issue, which is the geographical discrimination. I mean, geographical discrimination really, and it's not just as a result of fragmentation, though obviously in the case that Memo was talking about specifically, there was the fragmentation of the health system aggravated it, but certainly that's a problem, I think, in country after country after country, where different regions of the country are basically budgeted for differently. I mean, the formula that, say, a central government may use to disperse funds to subnational governments may be one formula, but either in the way that the formula is set out, is designed, or in the way that it's implemented, very often you'll find that the residents in one, say, state in a country are getting per capita more for the same services than people in another state. I mean, I know, for instance, say in the U.S. where I am, a lot of the public education is funded through property taxes. Now, property taxes generally are a progressive form of taxation, and that's good. But of course, property taxes are based on the value of property. And so what you have is in areas where the property is very valuable, the income from property taxes is quite high, and therefore the funding of schools is quite good. Whereas in areas where the property values are lower, you get less income for schools, and so the schools tend to be a poor quality. I mean, there's some effort to equalize that, but in general it's seen as a very discriminatory funding scheme for public education in this country. So I think the geography is really a consistent problem country after country in terms of the budget.
Mm-hmm. Thank you, Anne and Guillermo. There's a question from Ajay Kumar. In India, highest percentage of underweight and stunted children, 47.9% and 53.9%, belongs to Dalit communities, and female malnutrition is also worse among Dalits. The percentage of Dalit children received vaccinations declined from 41% from 1998 to 1999 to 39% in 2010. In India, health is one area in which worst form of discrimination operates, especially when it comes to children and women from Dalit communities. Unless and until a binding law at national level, this cannot be tackled, such structural discriminations. Thank you, Ajay, for your comment and question.
I believe that, I'm sorry, and
No, go ahead, Mo.
Okay, thank you.
Yeah.
Well, that issue is very interesting, and I believe that is the one great example around substantive discrimination and was talking about in her presentation. Perhaps it is not in any law, but the effects of the budgeting decision, it is discriminatory around this population. I don't know, I will have to get into the details, but perhaps this could be a case for a administrative litigation, and perhaps this population could ask for the legal protection of the courts because of the decrease of the budget for vaccinations, and I don't know how we still have one data missing here, that is how much children we have in this population, and the population, I mean, affected around this issue. I guess it's awful what is happening, and I would like to see a little bit more of it, so we could give a better opinion, but I'm pretty sure we do have a case to fight here. Thank you.
Thank you, Memo. I don't see any hands or any other comments, so I'm going to pass on the microphone to the screen to Memo, and he's going to show us a video that summarizes the case that he presented, and it has English subtitles, so I think it's going to be a nice way to close this webinar.
Thank you, Rocio, and I want to tell you, we made this video when we finished our Nuevo León goal, and we were very happy. And the videos are a very powerful way to communicate. And still, we're dealing with a new goal that is in a national scheme. So, well, I'm sorry. Can you please send me the invitation to? Can you see my screen right now?
Yes.
You're okay. Perfect. So here it is.
En Nuevo
Lucio,
León.
I'm not seeing
No,
it.
no,
No.
we can't see you, Memo. Can you please stop it?
I just stopped it.
Okay.
Can you send me the invitation again? No, that was not.
Uh-huh.
Okay, 1 second. Let's do it again.
There you go. Now can you?
Yes, now we can see you.
Perfect.
En Nuevo León, en promedio 100 personas al año son discriminadas por estar viejos o enfermos. Desde hace 20 años, el León niega la atención médica a las personas por ser mayores de 50 años o padecer diabetes, hipertensión, obesidad, VIH y demás enfermedades preexistentes amparados por la ley. Las fracciones 4 y 5 de la ley del León violan los derechos humanos y van en contra de los acuerdos internacionales que México se ha comprometido a cumplir. Ya no más. En el 2011, la rebelión de los enfermos llegó a Nuevo León y comenzó a trabajar arduamente con un grupo de discriminados neoleonenses con el firme objetivo de exigir su derecho a la salud. Motivados por la experiencia adquirida en el estado de Sonora, se logró modificar la ley del Istezón. La rebelión de los enfermos. Capítulo Nuevo León mantuvo su lucha constante por 2 años, logrando que la presión social se sintiera, y fue así como el 2 de octubre del 2013, con 23 votos a favor, 0 votos en contra y 16 abstenciones, el Congreso del Estado de Nuevo León aprobó las reformas a la ley del León para evitar que sigan discriminando a los enfermos por estar enfermos. El triunfo es de todos. La rebelión de los enfermos avanza en su lucha contra la discriminación en el acceso a los servicios públicos de salud. Con las reformas publicadas en el periódico oficial del Gobierno del Estado de Nuevo León, comienza una nueva era sin leyes discriminatorias en el sistema de salud mexicano. En nosotros está el cambio. Únete a la rebelión de los enfermos. www.rebeliondenfermos.org. Teléfono 01800-841-3212.
Thank you very much, Memo.
Thank you.
Well, I will let you, if you have any final remarks, Anne or Memo, I will let you close. And I just want to remind everybody that the presentations and recording for this webinar will become available on the IVP website later today. And a brief evaluation at the end of the webinar will pop on your screens. We would appreciate if you can fill that out. And we hope to see you next week for the final webinar of this series. And Memo, please, final remarks.
Just thanks everybody for participating, and I do encourage you again to read the full handbook. Some of the case studies are really interesting, and I'm sure the organizations that are featured in the particular booklets would be happy to answer the more detailed questions. So thanks again, and have a great day or evening.
And well, just to thank IVP, thank Anne and Rocio, and congratulate Anne and Elena for the handbooks. They are very useful and they are very beautiful as well. The design is beautiful. And thank you for everybody for listening and to paying attention for what we had to say. I will send everything to Rocio so she can host it and share it with all of you. And I hope to see you soon. Thank you very much.
Thank you very much, Anne Bleiberg and Guillermo Noriega, and to all of you for joining us today. Have a great rest of the day.